Bueno, hello everyone. My name is Loli, and today, along with my classmate Laura and Angeles, we are going to talk about autism spectrum disorder, or ASD. In our presentation, we will cover various aspects of this disorder, include its characteristic, cause, diagnostic, and treatment. The index of our presentation is a follow. First, we will have general introduction to ASD, main characteristic, cause of ASD, diagnostic, treatment options, conclusion, question and closure. Hello, my name is Loli and I'm from Vigo, and I am studying speech therapy, and I'm going to a brief introduction and discussing the characteristic of disorder. In the slide 3, autism spectrum disorder, or ASD, is a neurodevelopmental disorder that affects a person's ability to communicate and interact socially. At its name suggests, is it a spectrum, which means that its impression can vary widely from person to person, ranging from mild difficulties in conversation to severe challenges in understanding emotions or social situations. Characteristic of autism. In slide 4, we will discuss the main characteristic. People with ASD often face difficulties in communication, such as interpreting non-verbal language or maintaining a fluent conversation. They may also show repetitive behaviors, such as rocking or repeat practice, which can help them reduce anxiety. Additionally, individuals with ASD tend to resist change in their routines, preferring predictable and structured environments.
Hello, I am Laura. I am from Huesca. I'm studying speech therapy, and I'm going to tell to you about the causes of a night diagnosis. Causes of autism. The sub-causes of autism spectrum disorder are not yet known, but its prevalence has risen considerably in recent decades. Some of the contributing factors include change and diagnostic criteria, increasing awareness on symptoms among healthcare professionals and families, and advancement in detection medium. Its exceptions to others factors in future research to determine whether the disease is insidious is genuine. The need to extend early intervention service and psychoeducational programs is also spacing along with the importance of evaluating the comorbidity between autism and other disabilities more quartiles using advanced tools. Diagnostics of autism. Two main categories have been prospects. Primary or diagnostic autism with an specific genetics basis. And secondary or syndromatic autism associated with neurological, genetic, or archaic condition. Tillichen the theories should one also include genetics and neurobiology factors. Other psychology exclamation with attributed autism to problems in the mother-child relationships have been diminished due to a lack of science basics. In terms of diagnostics, the DCM-5 suggests a comprehensive evaluation, considering factors family, school, and clinical context. Diagnostic criteria include persistence deficits in communication and social interaction, and the presence of restricted and repeated patterns of vision. Differentiation diagnostic is key to a good diagnosis. Thanks.
Hello, my name is Ángeles and I live in San Sencio. I'm also studying speech therapy, and I will finish by talking about the treatments and conclusions. In this slide 5, ASD treatments, autism spectrum disorder requires a comprehensive and multidisciplinary intervention tailored to individual needs. Some of the most common therapies to improve in communication skills, motor skills, and social behavior are one, logopedic intervention. Speech therapy is essential for improving the communication skills of individuals with ASD. This includes the development of both verbal and non-verbal language through gestures, images, and assistive technology. The use of augmentative and alternative communication systems, AAC, such a pictogram or technological device, is key to improving the ability to express needs, thoughts, and emotions. Speech therapy can help individuals better understand and express their emotions, needs, and desires. 2, occupational therapy. Occupational therapy entails fine and gross motor skill, coordinations, and sensory integrations. It focuses on daily living activities so that individuals with ASD can be more independent in tasks like dressing, eating, or personal care. Occupational therapists work with the personality strategies that address both sensory difficulties and motor coordination challenges, improving participation in family, school, and community settings. And 3, applied behavior analysis, ABA. ABA is one of the most well-supported interventions for ASD. This therapy is based on the principles of learning and positive reinforcement, helping to teach social, communication, and academic skills. It is also used to reduce problematic behaviors by identifying triggers and reinforcing desirable behaviors. Autism is a developmental disorder characterized by difficulties in communication and social relationships, as well as the prevalence of repetitive behaviors and resistance to change. The precise cause of ASD are not yet clear. However, its increased prevalence in recent decades has sparked discussions about potential methodological factors and change in diagnostic criteria. It is essential to implement interventions tailored to each individual from the beginning. Speech therapy, occupational therapy, applied behavior analysis are some of the commonly used interventions that have proven effective in improving communication, motor skill, and socialization. In conclusion, the sum of 20% for each element result in a closed wheel and the growing understanding of ASD, along with improvements in diagnostic criteria and intervention service, is crucial to adequately addressing the needs of individuals with disorder.
If anyone has any question, now is the time. Well, Since no one has any question, we will proceed. We have prepared a brochure for families of individuals with ASD. This brochure contains useful recommendations for managing ASD at home. Additionally, it includes contact information in case you have any question in the future. There is also a QR code that links to more online resources.
The creation of this information has been based and cited in the same obtaining from the following literature: Autism Spectrum Disorder, prevalencia de los trastornos del espectro autista y autismo, revisión conceptual.
Hello, thank you very much. We hope to like it and this information has been useful to all of you. Bye.